Welcome to another episode of the Science Guide ASAP Learning, where we simplify complex medical topics. Today, we delve into the depths of human behavior to study a niche, but essential aspect of psychiatry known as philias. It's crucial to understand that while philia, in common parlance, denotes a strong affinity or love for something, in the psychiatric context, it refers to paraphilic disorders. These disorders involve intense and persistent sexual interests that are atypical or extreme. Paraphilias themselves are not mental disorders. According to the DSM-5, for these sexual interests to be diagnosed as a paraphilic disorder, they must cause distress or impairment to the individual or involve harm or risk of harm to others. Let's examine the 8 specific paraphilic disorders defined by the DSM-5. Voyeuristic disorder. Here, sexual arousal is associated with observing an unsuspecting person who is naked, in the process of disrobing, or engaging in sexual activity. For a diagnosis, the person must have acted on these urges with a non-consenting person, or these urges must cause significant distress or interpersonal difficulty. Exhibitionistic disorder. Characterized by sexual arousal from the exposure of one's genitals or sexual acts to a non-consenting person. To be diagnosed, the individual must have acted on these urges, or the urges have caused marked distress or interpersonal difficulty. Freuderistic disorder. This disorder involves gaining sexual pleasure or arousal from touching or rubbing against a non-consenting person. Like other paraphilic disorders, acting on these urges or experiencing significant distress or interpersonal difficulty due to them is a criterion for diagnosis. Sexual masochism disorder. Here, individuals become sexually excited through the act of being humiliated, beaten, bound, or otherwise suffering. The sexual arousal from these acts must cause clinically significant distress or impairment in social, occupational, or other important areas of functioning for a diagnosis. Sexual sadism disorder. This disorder involves gaining sexual arousal through the physical or emotional suffering of another person. The diagnosis is made if the individual has acted on these sexual urges with a non-consenting person, or the sexual urges or fantasies cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Pedophilic disorder. This is a sexual interest in prepubescent children, typically 13 years or younger. It's important to note that the individual with this disorder must be age 16 or older and at least 5 years older than the child or children in question for a diagnosis to be made. The sexual fantasies, urges, or behaviors must cause significant distress or impairment in social, occupational, or other important areas of functioning. Fetishistic disorder. Here, sexual arousal is derived from either inanimate objects or a highly specific focus on non-genital body parts. The fantasies, sexual urges, or behaviors must cause clinically significant distress or impairment in social, occupational, or other important areas of functioning for a diagnosis to be made. Transvestic disorder. This involves sexual arousal from cross-dressing. The condition is most often diagnosed in heterosexual men. For a diagnosis, the fantasies, sexual urges, or behaviors must cause significant distress or impairment in social, occupational, or other important areas of functioning. The approach to diagnosing these disorders involves a comprehensive assessment, often a detailed interview, and sometimes a psychological evaluation. These are delicate topics that you, as future healthcare providers, must approach with utmost respect and non-judgment. Treatment usually involves psychotherapy, often cognitive behavioral therapy, to help the individual manage their symptoms and, importantly, avoid acting on any urges that may cause harm to themselves or others. Sometimes, medications such as selective serotonin reuptake inhibitors or anti-androgens may be prescribed. In summary, understanding and managing paraphilic disorders require a nuanced understanding of the interplay between biological, psychological, and social factors. It is incumbent on us, as medical professionals, to provide the best, most compassionate care to all our patients, irrespective of their struggles. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one.